It's the year 1879. You are a young British doctor, and you are standing in a hut in the kingdom of Bunyoro, in what is now Uganda, and you are about to see something that will stay with you for the rest of your life. A young woman is lying on a bed. She is about to give birth, but the birth cannot happen the normal way. Both she and the baby will die unless someone opens her body and lifts the child out. A caesarean section. And back home, in the London you came from, this operation is a death sentence. In Europe, at this very moment, cutting a living woman open to deliver a baby kills the mother almost every single time. It is a last, desperate act performed on women who are already dying. But the man stepping forward here is not panicking. He is calm. He washes his hands, and he washes the woman's abdomen with banana wine. He gives her more of the wine to drink until she is deeply, peacefully sedated, anesthetized. His assistants are ready. He makes a single confident cut, exactly where he means to, murmuring to steady the patient. He controls the bleeding as he goes, some of it with a hot iron. He lifts a living baby out into the world. He removes the afterbirth. He presses the womb to help it contract. He cleans the wound, and he closes her up with pins and a paste. Days later, the mother is healed and well, holding her child. You, the British doctor, write it all down in astonishment, because you have just watched a team of African surgeons perform, calmly and skillfully, an operation that your own advanced European medicine cannot yet survive. And the way they did it, the anesthesia, the cleanliness, the confidence, tells you this was not a wild gamble. This was routine. They had clearly done this many times before. So here is the question that should genuinely stop you. We're taught that surgery, real surgery with anesthesia and antiseptics, is a triumph of modern Western medicine, invented in the operating theaters of 19th century Europe. So how is it that a British doctor, in 1879, watched African healers perform a successful caesarean section, mother and baby both surviving, using techniques Europe had barely figured out? How deep does the history of African surgery actually go, and why were you never told any of this? Let's get into it. That caesarean in Bunyoro is not a legend. It was witnessed and carefully recorded by a real medical man named Robert Felkin, and his account was published in a European medical journal. And the details are what make it extraordinary, because every single one of them points to a mature, practiced surgical tradition, not a lucky accident. Start with the anesthesia. The surgeon used banana wine to put the woman into a calm, sedated state before cutting. Think about what that means. They understood that you must manage the patient's pain and consciousness before you operate. The entire principle of anesthesia. And remember the timing. Surgical anesthesia was brand new in Europe too. Ether and chloroform had only come into Western operating rooms a few decades earlier, in the 1840s. These African surgeons had their own working method for sedating a patient for major surgery, and they used it as a matter of course. Then there's the cleanliness, and this is the part that truly stunned the European observer. The surgeon washed his hands and the patient's belly before cutting. He used the alcohol in the banana wine to clean. This is antisepsis, the practice of keeping a wound clean to stop it from becoming infected and killing the patient. And here is the staggering timing. In Europe, the idea that surgeons should clean their hands and instruments to prevent infection was, at that very moment, brand new and fiercely controversial. Joseph Lister had only recently begun promoting antiseptic surgery, and huge numbers of European doctors were still refusing to believe him, still operating in blood-caked coats, still killing patients with infections they themselves carried. And meanwhile, in a hut in Uganda, an African surgeon was already, calmly, doing exactly the right thing. Not because he had read a paper about germs, because a tradition of careful, clean surgery had taught him that this was how you kept a patient alive. And look at the aftercare, because this is where you can really see the maturity of it. The surgeon did not just deliver the baby and walk away. He worked to make the womb contract to stop the bleeding. He cleaned the wound with care. He closed the abdomen. The account describes the edges being held together and dressed with a paste. And then the woman was tended over the following days as the wound healed cleanly. Every one of those steps is something a modern surgeon still does. Stop the bleeding, close in layers, manage the recovery, watch for infection. None of it is improvised. It is a full procedure, beginning to end, with a plan for keeping the patient alive after the knife is put down. And it worked. That is the whole point. In Europe, the caesarean was a near-certain death. In Bunyoro, this woman and her baby both lived, and the observer made clear this was the expected result. That these surgeons had a genuine, repeatable technique for saving both mother and child. Read that again. At a time when the operation killed almost every European woman it touched, African surgeons had a method that routinely saved them. On this specific, difficult, dangerous operation, they were ahead. Now, the natural reaction, the one that Europeans had for a long time, is to say, that must have been a one-off, a fluke, some isolated genius. But it wasn't isolated at all, because surgery in Africa was old, and it was widespread, and the caesarean is only one branch of a much bigger tree. Let's talk about the most astonishing branch of all, surgery on the human skull. There is a procedure called trepanation. It means cutting or scraping a hole through the bone of the skull, deliberately, in a living person, usually to relieve pressure on the brain after a head injury or to treat severe headaches and other conditions. It is obviously one of the most terrifyingly delicate operations imaginable. One slip, and you are into the brain, and it is one of the oldest surgeries in all of human history, and it was practiced across the African continent. In parts of East Africa, among peoples like the Kisi and the Tende of the Highlands, traditional surgeons performed skull surgery so skillfully and so regularly that the practice survived into modern times, where doctors and researchers could actually watch it happen. These surgeons, respected specialists, their skills passed down through families and long apprenticeships, would open a patient's scalp, carefully scrape away damaged or pressing bone, protect the delicate layer over the brain, and close the wound. And their patients frequently survived, got up, and went on with their lives. We have the healed skulls to prove it. Ancient skulls from across Africa with trepanation holes whose edges show smooth, rounded new bone growth. And that smooth, healed bone is the loudest possible evidence, because bone can only grow like that if the person lived for months or years after the surgery. These were not autopsies. These were operations that people survived. Think about the sheer knowledge required. To cut into the skull without killing someone, you need to understand the layers of the head. You need to know how to control bleeding. You need to know how to keep the wound from becoming infected. You need steady hands, sharp, clean tools, and a patient you can keep still. This is real surgery, demanding real anatomical understanding, and African surgeons were doing it successfully for a very long time. And these were not random villagers hacking away in desperation. In these societies, the skull surgeon was a respected professional, a specialist, often from a family line of surgeons, who had trained for years under an older master before he was ever allowed to open a head on his own. He had his own set of purpose-made instruments, fine scraping tools and blades kept for this work. He knew which injuries could be helped and which could not. He knew to work slowly, to scrape rather than punch through, to stop the moment he reached the tough membrane protecting the brain and go no further. Patients and their families sought these men out and paid them precisely because they had a reputation for their patients surviving. This was a career. It was a craft with standards. It was, in every sense that matters, a medical profession. And notice how the same core skills show up again and again across these different operations, because that is the real tell. The caesarean surgeon in Uganda, the skull surgeon in the Kenyan highlands, the bone setter mending a shattered leg, they all relied on the same hard-won principles. Understand the body, keep it clean, manage the pain, control the blood, and close the wound well. That is not a scattering of lucky tricks. That is a shared surgical logic, worked out and refined across the continent over a very long time. And once you start looking, the surgical tradition is everywhere. Across the continent, traditional healers set and splinted broken bones with a sophistication that impressed the doctors who later examined their results. They stitched up wounds. They lanced and drained abscesses. They used the hot iron, cautery, to stop bleeding and seal wounds, the same principle surgeons use with electrocautery today. They removed growths. They had detailed knowledge of medicinal plants to reduce pain, fight infection, and speed healing, which they used alongside the knife. This was not superstition with a blade attached. This was a genuine surgical science, developed through centuries of observation, apprenticeship, and hard-won results, and held in the trained hands and memories of specialist healers. So let's go back to that hut in 1879 and the British doctor writing furiously in his notebook. He understood what he was seeing, even if the world he sent his report back to did not want to. He was watching people who had on their own arrived at the core principles of safe surgery, anesthesia, antisepsis, careful technique, control of bleeding, and in at least one life-and-death operation, they had arrived there ahead of Europe, not by reading European books, by their own long tradition. So why is this not common knowledge? Why did so many of us grow up with the idea that Africans had no medicine worth the name until Europeans arrived to bring it? The answer is the same shadow that falls over so much of this history. When Europeans colonized Africa, they told a story in which they were the bringers of science, medicine, and reason to a continent that had none. That story was extremely useful. It made conquest look like a gift, and a detailed, successful African surgical tradition, one that in some ways ran ahead of European medicine, simply did not fit that story. So it was ignored, minimized, or explained away. The reports, like Felkin's, sat in the archives. The healed, trepanned skulls sat in the collections. The evidence was there the whole time. It was just filed under curiosity instead of medicine, because the people telling the story could not let it be anything more. But look at what actually survived. A published eyewitness account by a European doctor of a flawless African caesarean with anesthesia and antisepsis. Skulls, by the many, bearing the smooth, healed scars of successful brain surgery. Generations of specialist surgeons, remembered by name and lineage, whose bone-setting and wound craft impressed the very people who came to dismiss them. That is not the record of a people without medicine. That is the record of a people who had been quietly, skillfully saving lives with the knife for longer than the country that came to look down on them had existed. So, did ancient Africans perform surgery? They performed caesarean sections that mothers survived when Europe could not save them. They cut successfully into the human skull, and their patients lived to grow new bone over the wound. They set bones, sealed wounds, and dulled pain, following the deep principles of surgery that the modern world likes to imagine it invented alone. They did it with banana wine and hot iron, and hands washed clean, and they did it well. The doctor closed his notebook that day, knowing he had witnessed something the history books would have to reckon with eventually. It took a long time, story lovers, but the skulls kept their scars, the report kept its words, and the truth kept its patience. The hands that held those knives are gone now. But what they knew was real, and now you know it too.